Hi, good evening. My name is Dr. Gina Diaz, and I wanted to welcome you to my treatment group video for the diagnostic category of anxiety disorder. I have a client. Her name is Sharon. She's a 23-year-old mother. She has a baby girl. She's feels that she's very happy with her life. It's everything she's dreamed of. She has a healthy baby, she has a wonderful marriage, and she described that to me that one morning she was brushing her teeth and she all of a sudden felt a rush of panic. She described it as her as if her heart was gonna pound out of her chest. She says she was in fear. She felt lots of fear. She couldn't catch her breath. She felt dizzy, and her palms became to, um, they started to sweat a lot. And from then on, her symptoms grew rapidly and intensely. She said that she felt like she was dying. From the moment she said that it didn't happen, it didn't last long, but she said it was a good 5 minutes, and she feared, she was afraid the whole time. Um, she was alone with her daughter at the time it happened, and unfortunately, it's not the only time she's experienced this. She has them at least once a week. Since she says this since the first episode was it was 2 months ago. So she's been having them once a week, and she wants them to stop. So that is why I went ahead and diagnosed her with panic disorder. Um, she's been the having panic attacks and experiencing them suddenly and unexpectedly. They are followed by future panic attacks and behavior changes based on the panic attacks. She has been showing some symptoms from Criteria A. So she has been experiencing rapid heart rate, shortness of breath, dizziness. Her palms began to sweat, and she had an intolerable fear that she was dying. And she also had her symptoms grew intensely rapidly and reached a intolerable pain that she was dying. As quickly as the episode started, it ended. She described it as the scariest 5 minutes of her life. Um, Her symptoms are not due to substance abuse or medical conditions or any other kind of mental disorder. Um, so I went ahead and diagnosed her with Access 5. Um, she is a mother of a baby girl and has everything she ever dreamed of: a happy marriage, a warm and welcoming home, and a 3 month old happy baby girl. Um, Sorry. I did put her as a 54 as the number because although she was experiencing panic attacks episodes, it hasn't impaired her in any way. She is still able to care for herself and her baby. She's just worried, and she wants them to go away. She wants to feel better. Um, so the client's symptoms are not due to substance abuse, medical condition, or any other kind of mental disorder. So that is why I diagnosed her with a panic disorder, Axis 5.